The screen is visible?
Yeah, ma'am. It is good. Is it live? We can start.
Yeah. Yeah.
Okay. A very good evening, everyone. I, Shubham Bharti, and Misbah Kadri will be the moderators for today's session. We welcome you all to Cynodent Webinar Series 2023. Theme of the series is Unlocking Trends in Dentistry. And for today's session, we have with us Dr. Padma Priya ma'am. Ma'am did BDS and MDS in orthodontics and dentofacial orthopedics. She has done PGDHM and she has a PhD. Today, for the session topic is State of the Art Orthodontics, a bird eye view. I would like ma'am to please start with the presentation.
Good evening. Greetings to you all. Changes in way of life. Those who keep themselves abreast with these changes excels in career and life. Orthodontics is no exception. With each and every year, newer changes and advances takes place in the field of orthodontics. Here in this section, I share certain advances which had made an impact in the field of orthodontics. I would like to discuss these topics under the following headings. Self-ligating brackets. A newer type of self-ligating brackets called innovation is a twin brackets made entirely with metal and utilize a special clip blade in the brackets. Pressure from a specific type of arch wire that activated the clip and delivered the torque to each tooth, resulting in fast and directed results. We come out to smart clip brackets. This is another type of self-ligating brackets. Do not have a sliding door or a separate clips. Speed brackets. Speed brackets stands for spring-loaded precision edgewise energy delivery brackets. These brackets do not hinder with the movement of the wire. Once the wire gets deflected, a spring clip provided with the deflection control of the wire in its proper position. In this, there will be the increase of hygiene. Time brackets. Speed brackets need a heavy force to slide the clip to open during the treatment. To overcome these, a new development known as time brackets. This advantage is easy to open, hygiene is more. Smart brackets with nanomechanical sensor. A nanomechanical sensor can be fabricated and incorporated into the base of the brackets in order to provide a real-time feedback about the applied orthodontic force. It can be adjustable and applied force within the biological range with a minimal side effects. Demont 3, newer type of Demont brackets, Demont 3, which is a part of ceramics, either clear or tooth color, or a partially metal. Appears smaller in teeth, more comfortable to the patients. Energy brackets, these give less friction and more control. And we come on to APC brackets. This APC brackets is nothing but adhesive coated appliance system. Brackets are available with bonding agents already placed. We have to just pick, place, and just have to cure it. No bracket handling problems with each individual brackets can be easily identified. Indirect bonding, flowable composites are used to place the brackets in a tray, and tray is placed in the mouth and cured. Telemetric brackets. These telemetric brackets are instrumented with a CMOS, that is complementary metal oxide semiconductor. This is possible to measure the 3D force and the movement of vector acting on an individual tooth. This sensor is more equipped with a slot component of standardized ceramic brackets, and it was telemetrically read out for over a distance of sufficient to allow the contactless operation in orthodontic appliances. The telemetric brackets extracted the center data, digitalized and decoded by the reading unit. New coating around the brackets. It could inhibit plaque control, growth and decalcification, wearing, fixed appliances without decreasing the bond strength between the brackets and teeth. Coating made a calcium phosphate base at release the zinc oxide. That zinc that exhibits a growth of acid producing bacteria and demineralize the teeth and reduce the calculus. You come on to wires. Technologies such as a nickel titanium alloy have replaced the traditional stainless steel wire, providing with a temperature sensitivity wire that allows a continuous movement of teeth over a longer period of time. Thermal activating arch wires. It gets activated to retain original shape due to the heat present in an oral cavity. It has a gentle continuous force. Titanium reverse curve, which is used for molar rotation and maintain the anterior torque without a crown tipping. Nickel-free titanium beta-3 arch wire, which provides the strength and versatility of the stainless steel along with the resilience of the nickel titanium. Beta-3 offers a small surface on an excellent sliding moment. CNA is nothing but a connective cut new arch wire, a new variant of titanium molybdenum arch wire, which is best for a closure mechanics in sliding mechanics. And for intrusions, loops and bends is very easy to make. Kinetic friction force is very low. Benefits in clinical situation is where the engagement of the wire of the bracket in malaligned teeth is easy, and it will control the force of the teeth and supporting tissues. Super elastic wires and composites wires. To avoid root resorption, this can be caused by an application of an oversized force during the ortho treatment. Fiber reinforced composites. These are made by the filtration method. Filtration method is nothing but fiber bundles which are pulled through the extruded, welded with the monomer and then cured with the heat pressure, resulting in polymerization. During curing, wetted fibers will form in a desired cross-section, either a circular or a rectangular. These have a elastic recovery aesthetics, and these are used for a sliding mechanics. Nickel-free austenite stainless steel and TMA wire. These are suggested for the history for have hypersensitivity. TMA wire, which is used for retraction, detailing, and final settling. These have decreased surface resorptions and decreased frictional forces. Titanium, aluminum alloy. These which have increased tooth movement and decreased corrosions. Smooth continuous tooth movement used for the buccal tooth movement. This is used for expansion spring tooth. Optic flux. This optic flux is made up of a clear optical fiber, no sharp ends. This is used for the bicuspid retractions. Dual flex wires. These are used to control the molar, is used in posterior segments, and it is used for an anterior segment also. Then we come on to ligatures. These ligatures, these are available in sizes, 3 sizes and 7 colors, present as translucent white, silver, blue, green, yellow, and red. Sizes we can get is extra small, small, and medium we can get. This is applied similar to the conventional elastic ligatures. Once placed on the brackets, it creates the passive ligatures on a slot that makes a arch wire free to slice and to produce the effect on a dentoalveolar structures. These are motifs. These are used to motivate the kids during the treatment. These are the stickers we can use for the palatal expansion screws. near the expansion screws. We come on to bonding materials. Bonding materials which we are using is 6th, 7th, 8th and generation. In 8th generation, this is a nano size fillers 12 nm. In this, the color change adhesive is there. This is used to enhance the bracket positioning and flash cleanup. The advantage of color changing adhesive is a visibility as well as an identifiable clear up and adhesive remnants at the bracket seating as well as an identifiable clear up of adhesive remnants after debonding. We come on to anchorage. We all know how far the anchorage is so important in orthodontic treatments. Skeletal anchorage system has mainly changed the possibility and paradigms in the orthodontic treatments and in orthodontic movements. Anchorage, conventional techniques used either intraoral sites or an extraoral sites. Conservation of orthodontic anchorage has been one of the perennial problem for the orthodontics. Mini implants and mini plates which are used. Mini plates, first, the capacity to provide the alternative treatment possibility that were not previously feasible. The second is an absolutely anchorage leads to reduction in treatment time and more reliable treatment plans. Third, the anchorage system eliminates the dependency on the patient complaints. In mini implants, these are known as temporary anchorage devices, which helps to bring down the effect employed to prevent anchorage loss. In orthodontics, mini implants is used for orthopedic maxillary expansions. These will reduce the undesirable tooth movement. Mini implants are a reliable source of orthopedic anchorage since they provide an acceptable skeletal changes within a minimal side effect in a teeth used as an anchorage. We come to a retention thing. Retention, the way to preserve the fantastic new smile is through retention phase of an orthodontic treatment. To keep the beautiful new smile, patient needs to wearing the retainer exactly as doctor instructed. Retainers, what we used is traditional retainers. These traditional retainers, which are made by the acrylic materials and metal and that stretches around the front teeth. We all know how the traditional retainer will be. These traditionals are a common type of retainers to preserve the smile. And next is clear aligner style retainers. These are made up of a thin, smooth, comfortable plastic designed to fit over the front 6 teeth. Then come on to fixed retainers. That fixed retainers are small, customized made wire designed with fit of the natural curve of the teeth and bonded in place of a back of a lingual side of the teeth. And digital retainers. Now, these are advanced things which are used as a retainer. This is after taking the digital scan and send in format of stereolithography files to the laboratory. These retainers can be get. These users or these advanced software to digitally remove the braces from the virtual models, allowing them to print exactly the accurate 3D models for the retainer fabrications. Softwares. We all know how far the softwares are useful in many things. In dentistry, mainly in orthodontics, these are main source of treatment procedure we can make it out. Mainly software which the extraction decision making can be done. Landmass deductions also can be done, determining the growth status of diagnosing tumor, canine impactions, and predicting the size of unerupted teeth, and to determine the force, how far we needed to align the teeth. Treatment overcomes a class 2 and class 3 for the use of incorrectly. If the software is incorrectly used, there can be a mislead of informations. Software which turns into an effective tool in use of advanced imaging for prerequisite to plan the stage of treatment based on the achievement of a final results, visualizing the increased efficiency of the doctors and patients. Extra imaging. This appearance perfect for the periodontics, the elderly person, a children, and the patients which have a gag reflex or a pain. Plan Mecha Pro 3D, which is used for an orthodontics treatment and implantology, requires 3D visualization of an oral cavity. Intraoral imaging, directly to contact with an patient oral cavity. Start Pro and Fonta XD is used. Other method, Pony, computer tomography, 3D scanning, and stereophoto geometry. Further orthodontics in future, this imaging software which are used in diagnosing the treatment plan is CAD-CAM. 3D visualization of the patient in oral cavity is more effective package. Advanced imaging. This is one of the thing which helps to fragment the data processing. Robots. How robotic is used in orthodontics. This is very interesting. You have to know robots can be controlled either external and internal device, mainly used in a normally industrial fields, manufacturing process and medical field and minimal invasive surgeries. Similarly, dentistry has seen enormous enhancement progressions from customary method to the advanced methods. Robot have many application fields. One is in Sigma system and Shermile system. In Sigma, framework furnishes a clinician with the software that helps them plan and draw the final occlusion, and the archwires are figure out to move the teeth in ideal results. The customs archwire which are made for printing the robot that uses the system provide to bend the wires according to the patient teeth. Smile application start with an ortho treatment to utilize the digital imaging of the patient mouth and teeth, taking either a white light scanner or a CBCT. These robots which have a automated wire grasp with the warm twisted the wire pattern that will manage the teeth into their favorable position. All advances utilize 3D imaging, DC system for diagnostics and the treatment plan. In lingual orthodontics, AMD system is used, that is advanced molar digitalization, which increases the treatment accuracy, efficacy, and efficiency. And AI in orthodontics, which the AI-based solution allows you to scan your mouth within your phone and send the images to your orthodontics. AI-based dental monitoring apps can detect different oral conditions, predict tooth movements, and even track your treatment programs. Stem cells. This is very interesting to know about the stem cells, how the stem cells which are used in orthodontics. Usually, these stem cells differentiate into muscle, bone, and neural tissues, which the stem cells which are inactive that will be inactive in an uninjured teeth. Stem cells lie in an inactivate cells to help the tissues to heal. Usually stem cells which are present in a periodontal ligament, dental pulp, around the follicles and tip of the roots. Stem cells, application of stem cells in orthodontics. How the stem cells are used in orthodontics are, these are used in alveolar bone defect repair. That is, when we are extracting the premolars, sometimes the buccal plate may be injured. So if the buccal plate could be lost during the extractions, these defects can be filled with the stem cells. In oral tissue remodelization and distraction osteogenesis also, these stem cells helps in a regeneration and bony tissues consolidations. In TMJ, these generates mesenchymal cells, this cartilage and fibroblasts that can be formed. And in root bioengineering also, this can be used. I hope that these brief talks has been given a bird's eye view for recent advances in orthodontics. Thanks for the organizers. Thanks for the moderators and the patient listeners. Thank you.
Thank you so much, ma'am, for such an informative session. Ma'am, we have few questions for you. Should I ask, ma'am?
Yeah, sure.
Ma'am, is there any fixed protocol for loading of orthodontic mini implants?
The bone has actually before placing an implant mainly it's a small screw that doesn't needed much protocol. It's a small screw we can insert in between the thing. Age is a bit consideration.
Oh, okay, ma'am. Thank you so much for the answer. And ma'am, such a wonderful session you have given to us. And thank you so much, Dr. Anmol Bagaria, ma'am, and Dr. Ashish Chandra, sir, for organizing such a useful webinar series for all of us. And thank you so much, my co-moderator, Shubham Bharti. Thank you, everyone. Thank you, all the participants who joined us today. And I kindly request all the viewers to please kindly like, share, and subscribe our YouTube channel. Thank you so much.
Thank you. Thank you so much.
Thank you, ma'am.
Thank you.